The gastric bypass procedure, it is one of the commonest weight loss procedures that we perform nowadays. It's been around for more than 50 years, and it has proven safety, efficiency, and provides excellent results in terms of weight loss and quality of life for the patients. It has been performed nowadays almost exclusively via keyhole laparoscopic surgery. And the basic principles involves creating a small gastric pouch by disconnecting the proximal part of the stomach from the distal part, and then creating a joint of the bowel, the small bowel, with this small gastric pouch in order to be able to drain this small gastric pouch. With this configuration, basically the food bypasses the whole distal stomach, the duodenum, and the first part of the bowel. And as a result, undigested food goes straight into the bowel, and that triggers signals from the gut into the brain, which is basically responsible for the metabolic response of the patients. And by changing the signals, we reset the metabolism of the patient, and this is why gastric bypass is one of the most effective weight loss surgery nowadays. I would say that gastric bypass is not considered anymore a major surgery. It does involve general anesthetic, which is extremely safe nowadays, and the hospital stay is 1 or 2 days. It can even be performed in selected patients, low-risk patients, as a day surgery procedure. There have been studies that they have basically shown that the serious events from gastric bypass surgery is pretty much the same as any best medical treatment that includes medication and lifestyle modifications. And the complication rate is quite low, and they match basically any other straightforward, commonly performed abdominal surgery, like, for example, appendicectomy or cholecystectomy. And the risk also of mortality from these operations is extremely low, well below 1.2, 1.1%, and according to the data in the UK from the National Bariatric Registry, it's even well below that level. So I would say overall, gastric bypass surgery is a very effective and very safe surgery, and provides sustainable results in terms of weight loss, but also a very good quality of life after the surgery. Laparoscopic gastric bypass is actually not a painful procedure at all. It is very well tolerated by the patients. The patients typically, they might feel mild to moderate amount of abdominal discomfort or pain for the first 1 or 2 days, minimal amount of nausea, and they will recover very soon. The typical hospital stay after a laparoscopic gastric bypass is basically 1 or 2 days in the hospital. It can be performed also in selected low-risk patients as a day surgery procedure, and the recovery is very straightforward. Obviously, the patients, they need to adhere with a special diet post-op, but other than that, I would say after 1 or 2 weeks, the patients are pretty much back to normal activities. What is interesting is that the rate of weight loss after gastric bypass is quite rapid for the first weeks or 3 months. The patients, they can lose 15-20% of the total weight or 30% of their excess weight in the first few weeks or 3 months. Then the weight loss continues typically for 6 months. And then some patients, they will continue to lose weight for 1, 1.5, or 2 years, or some patients, they will start plateau in terms of the weight loss within 1 year or so. But the first few weeks or 3 months, the weight loss is very rapid and very impressive. Yeah. Gastric bypass surgery, it has proven its efficacy and efficiency in the long term. Patients, they can lose typically 60 to 70% of their excess weight or 35% of the total weight. Obviously, the response to this type of treatment varies as any other treatment for any other disease. But the results suggest that the patients, they can sustain this weight loss in the long term. Obviously, we will encourage the patients, along with the surgery, to engage with the teams and the doctors, and in order to implement positive behavior and dietetic changes in order to optimize the results and make sure that they don't experience weight regain in the future.